We move on to Strep B, and here are pathologies that are mediated by Streptococcus B, and the sequels to this pathology, pharyngitis, is scarlet fever in this particular case, and the sequel to scarlet fever is heart valve vegetations at the mitral valve. Talk to you a little bit more about that coming up, and I won't go through all of these at this point, but I shared with you that there are certain conditions that can cause pneumonia in the immunocompromised, and a sequel to a pneumonia can be meningitis, where the infection spreads to the lining of the spinal cord and brain, the central nervous system. Now we pick up here also Streptococcus group A stress. The first manifestation of an infection is strep throat, and this is where the throat is very red and very, very painful. Okay, sometimes called scarlet. I'll relax on that. And then scarlet fever, a condition of the skin. This rash is scarlatina, and the tongue takes on a stippled appearance, little dots on the skin. Now this can communicate to this strep then has an affinity for the mitral valve in the heart, and it can result, when we study the heart, I'll show you vegetations, actually plant life that grows in that and around that valve, and causes the valve to become rigid and insufficient, and it can be so diseased that a person can't maintain normal function of their heart. Another interesting manifestation of strep is cellulitis. This is a brilliant skin. It's an infection of the skin. It's very hot to the touch, and it's quite painful. And then devastating with a horrible prognosis is necrotizing fasciitis. And again, when we deal with the skin in particular, we'll talk about this. This leads to an amputation. So this is all result of staph infection. And then I'm going to skip over these two forms of strep B. I do want to mention that gangrene can result as end-stage infection of strep. Now there are other reasons for gangrene, but gangrene can be classified as dry, which means it's not weeping, moist, where the bacteria thrives in a moist environment, and then gas gangrene, which is anaerobic and flourishes without forms of respiration. Okay. And then a bacterial infection that's around pools, whirlpools, sinks is Pseudomonas, and it's a virulent bacteria. It results in a greenish color. Here's a person who has infection in that is subungual, under the nails and into the nail beds, and so representing it flourishes in a moist environment, and so cleansing the fomites, way important, and obviously cleansing hands is way important. Now we move to viral. Herpes simplex 1 and 2, herpes simplex 1, cold sores. Okay, and once you have a virus, you have a virus. So it'll come in the form of, it'll manifest itself initially, and then it tends to recur. It may go away for a while, which would be in its latency, in a latent form, but you've got it. Once you have it, you've got it. So if you've had cold sores as a kid, you're going to tend to have cold sores throughout your life. And then herpes simplex 2 is a sexually transmitted disease that, like we say, once you have it, you'll have it forever. It'll go latent. It'll lie dormant on a nerve root, a nerve, and then under stress, the immune system, or idiopathically, we're not sure why it comes back, but it'll re-manifest. And then varicella zoster is chicken pox, which maybe you had or you didn't have. But people who had chicken pox as children are way more likely, because the virus stays in them all their life, when they get to older age, can develop shingles. Now, we've had students here at Point Loma, we had an epidemic of shingles among people your age. You can see here this pattern. It's a straight line. This is nerve root pattern, where the virus has an affinity for the nerve root that supplies this dermatome of the skin. And then I'm going to talk to you about how you fight it. You know that antibiotics are used to fight the bacteria. We'll talk about medications here in a second. But Epstein-Barr is mono, and so EBV is Epstein-Barr virus. And I think you're quite familiar with it, but I've given you some indications of signs and symptoms of Epstein-Barr, may be associated with chronic fatigue syndrome. There's a theory about that, not all the way demonstrated. And then cytomegalovirus, CMV, is a disease of the immunocompromised. So little guys who don't have a fully developed immune system, they can contract this virus in the birth canal, and they don't have an immunity outside of their mom. And some immunity is passed on through her milk, and then certainly there are other people who have immunosuppression. This particular case is a type of a virus called Kaposi's, HHV. This is actually a viral condition that moves into cancers of the skin. This person is immunocompromised as a result of having HIV/AIDS, and this skin condition is Kaposi syndrome. Medications for viruses, well, minimize symptoms. That's the best we can hope for. There's no preventative medication, and there's no medication that will speed up the process, but there's medication that will drop the symptoms, so keep that in mind. Okay, I'm going to go back to Epstein-Barr here just way quick. This slide causes me to think about this. And the Epstein-Barr, which is you're in the season of life through high school and now into college and early adulthood, you're vulnerable to this. And as a healthcare practitioner, be way heads up that splenomegaly can occur. The spleen gets enlarged and gets gelatinous and is way vulnerable. And you think about, well, an ice hockey player with this getting hit up into the boards, rupture of that spleen, now his spleen's got to come out. That person now becomes immunocompromised because it's a place where white blood cells are mature. And so they would be... So you just don't know. But you also don't run. When you're sick and you've got an enlarged spleen, you could get your blood pressure up sufficiently. If your workout was vigorous enough, you could have a spontaneous rupture of the spleen. And then there's some indication that there's linkage between people who have mononucleosis and multiple sclerosis. Not going to develop that a whole bunch. Okay. And then I'm going to finish up with Lyme disease. You know that Lyme disease results from a vector transfer of virus, bacteria, where a tick bites an infected animal, a deer or a fox or whatever, and it ingests that blood and then injects that bacteria into another source, and certainly that could be you or your cousin or whoever's out in the forest. And this is dubbed euphemistically the great imitator because the signs and symptoms are so varied that it looks like, I mean, there are people, maybe I'll talk to you about this in class, one of our former ASB presidents here at PLNU had this as a young professional after graduation, and he had psychogenic complications and became suicidal. One of the most cheerful, positive, get after it accomplishers, achievers. And if people couldn't figure out, he couldn't figure it out. He wasn't thinking clearly, but fortunately it was determined that this is what it was. You can see how tiny that tick is. So if you're out in the forest, you come back in, and it's way important to scan your skin. Signs and symptoms, you can see here the characteristic bullseye rash. But that fades over time. That will be eliminated. So anyway, we're underway with our study of infectious disease. Look forward to seeing you in class, and keep on learning. Be students of our topics. Okay, bless you guys. Bye.